Greetings, everybody. It's wonderful to see you again, and welcome to the 43rd now of our Town Hall series. As always, I want to thank the members and the chairs of our Society for Leading Medicine for all their wonderful support of this series. You know, today we're taking a little different approach. We usually have some clinical experts. Today we have some business and operational experts talking about two areas I think you will find really interesting and are very impactful to the people that we serve. I often talk about our vision for the second century, which is 6 simple words: unparalleled safety, quality, service, and innovation. And part of the unparalleled, I always talk, has 2 aspects. One is always wanting to be the best, and the second is never being satisfied today with where we were yesterday. When we talk about our 5 priorities for our leaders and 5 focus areas, the first of those is I say to them, listen, if we're going to be unparalleled, you got to be able to look in the mirror and say, where are we maybe not quite as unparalleled as we want to be? So you fix it, you address it, you move it forward. And one of those areas we recognize, and frankly, it's a conversation I have with leaders across the country, is around access. And so today we're going to be talking around access. So what do I mean by access? Access is really you being able to be seen where you want to be seen, when you want to be seen, how you want to be seen, promptly, efficiently, effectively, and obviously compassionately in a wonderful setting. And that's difficult when there's a lot of demand and obviously a lot of people with illness. And so I want to talk about that both in the physician realm and in the hospital services realm. Clearly, technology is really key for that as well. So there'll be some overlap with the other part of our talk today, which is where do we involve technology in what we do? We see today and where we are, and the reason we created our Center for Innovation as really a transition point at which we can see digital technology and other technologies really transforming your experience as a patient, helping us serve the communities. And of course, you're hearing so much about AI and other things like that and how those impact. We have 2 real stated goals, which I keep the whole team grounded with. And first and foremost, and it fits very well with what we just talked about with access, is obsessively focus on our patients, our communities, the customers we have, the people we serve, and how we use technology to really improve that. And a very close second, though, is how do we improve the lives of the caregivers here at Houston Methodist? How do we use technology to amplify what they're able to do and to really connect them to the things that only human beings can do, right? The really personal, faith-based, touch-based, compassionate-based parts of healthcare, and remove the drudgery and the difficulty and really ground them to the passion and purpose of why we all do what we do. And so we'll be talking about some of those as well. And I have 2 amazing guests here with me today to talk about that. I have Michelle Stansberry, who's the Vice President of Innovation and IT Applications. She's been with Houston Methodist 31 years. We were just talking about that a second ago, which is absolutely amazing. And we also have Tisha Montgomery, who is our Senior Vice President of System Patient Access, 6 years now. We're working on her. She's got 25 to go, but we'll get her there. We've gotten actually quite a few questions ahead of time, which I always love to see. It tells me we've got a topic that people are really, really interested in. As always, you can text the word DeBakey, D-E-B-A-K-E-Y, to 37607, and we'll accumulate those questions, do our best to answer all of them. We've also got a live stream going, so you can type them right there in the box. And we have 2 great leaders of the institution. We have Adam Myers, who is a Vice President of Patient Access, and we have Marc Uralkan, who is Director of Innovation for us. And so they'll be able to answer many of your questions as well, both quite expert. So with that, I'm going to turn things over to Tisha to talk a little bit about access. Thanks for being here, Tisha.
Thank you so much. I am excited to have the opportunity to spend a few minutes to share what we are doing in access. I'm very passionate about it and have worked in access for several years. And it's something that I really want us to continue to work on and improve, as you've already heard, our goals and priorities. So I'm going to start off, though, with a little bit of humor, because although we have made a lot of significant advances in healthcare, in medicine, in the clinical arenas, when you think about scheduling an appointment, it often still feels like this. It feels like we are still in the Stone Ages when you try to schedule an appointment with your doctor. And I'm not just talking about here at Houston Methodist, but nationally, this is what it sometimes feels like. And this is where we are trying to evolve from. So when we talk about patient access, I actually don't have to read this definition because Dr. Boone said it so eloquently during his opening comments. But it really is making sure that we connect our patients with the right provider, the right services at the right time. And the key word I will say here is seamlessly, via the mode preferred by our patients. We know some patients prefer to schedule online. We know some want to text. Some may need to call in. So whatever the needs are of our patients, that's what we're aiming to meet when we think about patient access. And we know as we talk about access, sometimes we have fallen short. These comments are voices from the patient. And again, these are common themes that we hear nationally with patients trying to get appointments with their physicians or trying to get services scheduled. There are often delays. Sometimes appointments have to be rescheduled. There's delays on top of that. And even sometimes just the ease. If you call to schedule but you need a different location, oftentimes it's not easy. They're not able to schedule across the board. And so there's just been a lot of barriers that have been put in place that has made this process not always easy for our patients. And that is exactly what we want to address with our access initiatives. We know this is very important. Access is such a differentiator. There was a recent study done, and it looked at the top 10 factors of what patients look at when selecting a doctor's office to visit for their care. And of the top 10 reasons, 5 of them were access related. So we know this is top of mind for our patients. Of course, the first one is with insurance coverage, and that's no surprise. But number 2 and 3 are around office locations and the availability of appointments. And so that is what people are deciding. That's what they're looking at when they're deciding how and where to seek care. We also have recently looked at another study, and it showed that 8 in 10 patients reported that they would switch providers on convenience factors alone. Now, I'm a nurse by background. And when I first saw this, I was shocked because you think quality of care, you think about the reputation, the brand, but so many patients are willing to switch simply if it's not convenient. And so we are starting to actually look at this differently. And one of our other leaders, our new physician chair for the physician organization, you will hear a quote that she says, "Access is quality." And so that is why it is so important for us to focus on access. As we do this, we are impacting quality. As we know that when access to care is delayed, it certainly has an impact on our quality of care. And we are used to convenience in every aspect of our life. And many of you, and I know I can raise my hand as well, have gotten accustomed to the convenience of being able to order groceries when I want, order anything I want from Amazon and have it delivered. You can, order ride service, Ubers. I was surprised by the one at the bottom, Booster. I didn't know about that one, but you can even order gas to come be delivered to your place of employment. And I say all that to say, we are used to convenience in every aspect of our lives. So it is not unnatural that we would expect healthcare to give us that same level of convenience. And so when patients are seeking care, we know you don't want to wait. You want care that's convenient. You want it available when you need it available, and you want it to be easy. And that's what we are aiming to do with our initiatives. So this is our ideal patient journey. We want to make scheduling easy. I think that's the key word, easy. We also want quick availability. We want you to have seamless referrals. So we know that when patients come in, sometimes there are multiple downstream appointments and interactions they have to have with the healthcare system. We want those to be easy and seamless and well coordinated. We also want the ability to be able to schedule across any location that best fits your need. So this is what we think about when we're creating the ideal patient journey and the areas that we are focusing on as we look at access. And it's important to do this as we're continuing to grow. Last year, I was looking at the numbers. We actually surpassed 2 million visits in 2023 across our primary care and specialty appointments. So we are getting more and more patients and appointments coming to us. So we need to make sure that this process is seamless and convenient. So I'm going to walk through my next few slides and tell you some examples of what we are doing to actually make it easy. So we've heard the background, we've heard about the challenges, we understand the problem at hand. So I want to share with you, these are the initiatives that we're tackling. This is what we're doing to make scheduling easier across our system. The first one is around making scheduling easier and more convenient and providing you more options. And so we have recently updated our website. And you'll notice if you would go to our website and you were to search for a doctor, and let's say you put in primary care, you will now see the available times right then and there of our providers. And you're able to click into one of those times and actually schedule the appointment. Some people don't want to talk on the phones. They want to just be able to schedule online and make it easy. And so we wanted to provide that option. So this is just a screenshot of that example that is available actually on our website today. Another example on the right side is our ability to interact with our patients via text messaging. And so when downstream appointments are made, or even when your first appointment is made, we do have texting appointment reminders, and you're able to cancel and reschedule all through those appointment reminders. So the texting capability has been just another mode that we have implemented to give our patients more options to help make scheduling easier. One other initiative that we're working on has to do with our phones. And although data is telling us now that 80% of patients prefer to schedule online, we know that's not 100%. And then just due to your circumstances, often you still need to call. And so we are investing a lot of time and energy to make our scheduling and our phone process easier. These stats at the bottom are examples that we've pulled from our primary care office. These are actual phone metrics. When you call to schedule an appointment, I think there's a few things that everyone wants. They want the phone answered quickly. They don't want to wait on hold. We know your time is valuable, our time is valuable, so we want to be able to answer quickly. Everyone wants to be able to get their needs met and provide different options that will meet those particular needs. We also know that everyone wants to get to the right specialist. They want to get scheduled with the right service. It's frustrating on both sides if you show up and take time off work to show up to an appointment only to find out that that's not the right specialist or not the right care that you needed. And so we want to make sure that we're getting you to the right place. And then also we want to resolve your needs on the first call. First call resolution is what we call this. We want to minimize transfers and be able to help you with what you need and avoid delays. And so we are spending a lot of time to address all of these things when you call in. As I mentioned, the stats at the bottom are related to primary care, and you can see the tremendous progress we have been making over the past few years. On the left side, that top percentage is the percent of calls that are answered within 30 seconds. I told you we know you want the phone answered quickly, so that is our goal. We want to answer our phones within 30 seconds or less. That 93% says that 93% of our calls were answered within 30 seconds or less in the month of January for primary care. That bottom number is our speed to answer. Again, we want to answer the phones quickly within 30 seconds or less. So you can see on the graph on the right how we've been trending year over year. And so you can see that our service level, again, that's the percent of calls that are actually answered within 30 seconds, that has increased. So you see that blue line trending up, and you can see the speed to answer, that green line trending down. And that ultimately equates to less hold time. You don't have to wait on hold when people call. Another initiative that we've been working on to improve access is to augment our physician clinics. So we do understand that acute needs arise. Sometimes you wake up with a cough, sore throat, you want to be seen that day. And when you're not able to get in with your primary care doctor to be seen, or even with a nurse practitioner to be seen within their office, we now have 9 same-day clinics geographically placed across Houston that are able to address most of your acute needs. So we're very excited for these same-day clinics. It provides another option for our patients. We're able to see patients same day and next day. You can call to schedule, but you can also schedule online. In fact, now over 50% of the patients that go into these clinics are going online and finding convenient appointments, and they're scheduling right then and there. So we're excited for the success of these clinics, and we do have plans over this next year and the future years to continue to grow these and see these options increase for our patients. I already mentioned the convenient scheduling of the same-day clinics. This just shows you a screenshot. You can schedule these through our MyChart, through the electronic medical record, and also going directly to our website. Virtual urgent care is another access initiative. It provides another option for our patients that need urgent care. And you get this option from the convenience of your own homes. So we do have 24/7 virtual urgent care. Again, this is addressing those acute needs that come up. Sometimes you're not able to get to your doctor, and even the same day clinics that I mentioned, maybe you're not even physically able to get to one of those locations. So we do have this virtual option that patients are able to assess and get care. They can get assessed and get care for many of their acute needs. Again, providing more available access and options for our patients. And I know Michelle's going to talk a lot more about technology, so I'm not going to steal her thunder, but I'm just going to share with you just a snippet of some of the technologies that we are implementing to improve the access and scheduling experience. The first one I talked about a lot when I mentioned a lot of the work that we're doing with our phones. We get 6 million calls a year for scheduling into our centers. And so it's important for us to invest into that technology. So we are undergoing a major phone system upgrade. Again, that's foundational, but it's making sure that we have the infrastructure in place to continue to get our patients routed where they need to be routed, and that we're able to answer those phones quickly, as I mentioned. The other piece of technology that we are working on has to do with answering questions before you arrive. I know we've received questions, sometimes you walk into a clinic, you sign it, you check in for your appointment, and you're handed a clipboard. You have to fill out several pieces of paper. And so we want to make that experience easier. So we do have e-check-in turned on and available. You're able to check in for your appointments before you arrive. You can answer a series of questions, and that then minimizes the time at the desk when you come physically to check into your appointment. We are still expanding this. There are some additional questionnaires that we can add that are specialty specific, and that will reduce some of the redundancy, because sometimes if you see multiple clinics or multiple physicians in different specialties, there have been times where I'm sure you've had to repeat information. Our goal is to not have you do that. If you fill it out electronically in the system, that information carries over, and we won't only want to ask you the additional questions needed for that specialty. So that is one of the innovations and technology advances that we are in the process of rolling out. Another technology that we're excited about, where we've seen a lot of patients be able to get sooner appointments through this, is through our automated FastPass technology. So this is embedded in our EMR, and it places our patients on an automatic wait list. And so if we get a cancellation to an appointment, it will automatically notify patients via text message or email or through their MyChart that they have an option for a sooner appointment. And if they don't have to take it, they can still keep the appointment that they have. But if that new date and time works for them, they're able to click a button and it automatically reschedules their appointment to that sooner time, and they're able to get in. We've seen it work recently. I've seen it work within my own family recently, so I know that it's real, and it has improved access for patients. Last year, over 18,000 appointments were moved up because of this technology. So we're continuing to grow and expand that. And the last technology I want to mention on this slide is something that I talked about a little bit earlier, but it has to do with our bi-directional texting. We rolled this out a few years ago with our appointment reminders, and have continued to build on this technology so that when referrals are placed, patients do get text messages and they're able to coordinate their appointments through those text messages. So just to continue on with that, one of our other initiatives is we're really taking a deep dive, department by department, to automate more of our self-scheduling opportunities. So I mentioned being able to better coordinate the referrals through texting. When we rolled that out, it was only available for a certain number of tests and procedures. And we really had not implemented that yet for any of our physician appointments. Now what we're doing through our Access initiative is we are leveraging technology so that when an order is placed for a specialty, the patient receives a notification immediately, and they will have the ability to self-schedule that specialty referral. So there's algorithms built behind the scenes based on your diagnosis and based on what the referring physician has put in. So it automatically routes you to a physician or to a group of providers that see your particular indication. And you'll have the option to schedule with that provider, and you'll see the options across all of our locations that are available to you. So we have recently rolled this out for orthopedics, urology, and we recently went live with neurology. And we have 4 to 5 more areas that we will be rolling out this year. A large one will be imaging. So when you think about scheduling mammograms, MRIs, CTs, ultrasounds, we are going to be able to coordinate our referrals better and allow you the ability to schedule across any of our locations that best fit your needs. And we're also working to maximize availability. So I mentioned we're doing deep dives department by department. This is actually a real picture that was recently taken to show you how we are pulling in everyone to work on Access. It takes a village to do this. And so we're going area by area, and we're meeting with physicians, we're meeting with clinical staff, we're meeting with IT operators, and we're going through all of our scheduling rules, all of our criteria, with the whole goal to maximize availability. And so we're now able, through these efforts, to assess our schedules, to clean up anything that may have been blocking the schedule inadvertently, to maximize the access and capacity that we have available for our patients. So we are very, very excited about that. So what's next? What is on our horizon? We are continuing to break down silos to improve the scheduling experience. We are one Houston Methodist, we're one system, and we want you to feel that when our patients come to our locations. And so we want to be able to offer additional options based on our specialists and our physicians and availability that we have available. We also know that sometimes patients live in one location, they work in another. They may call a location that they're used to going to, but they need to go to another location because of work or travel that day. We want to be able to schedule our patients without having to transfer or without having unnecessary delays. So this is a huge transformation project that we are in the midst of. We are also continuing our efforts, and I just spoke about this, to maximize our availability and provide you options across the board. And then finally, we're continuing to offer new locations and new models of care. We have been increasing the number of nurse practitioners and physician assistants. I've already talked about our same-day clinics and virtual urgent care. We're continuing to grow our physician practices. And so we want to make sure that we are offering these locations and options that are convenient for you. So with that, I'm going to close. Now listen, I started with the Flintstones, so I am ending with the Jetsons. And I will leave with this to say, listen, they had convenience all figured out. They had this figured out from the start as they were looking ahead at the future, even from telemedicine, video calls. They were on it 30 years ago. So with that, I'm going to end here, and I look forward to the Q&A later on.
Thank you, Tisha. I hate to tell you, but we're all dating ourselves doing Flintstones. And my kids are like, who are they? But thank you very much. I think you can see the energy around this. And you know, back in late 2022, as we really said, okay, we got to lean into this much harder. We actually restructured the organization. We saw Tisha's talent. She was a vice president in the physician organization specifically, and said, we want to break down those silos. We want to look at this across the system. So we actually restructured the organization. She's a senior VP. She reports directly up to Mick Cantu, who's our chief strategic officer, kind of outside of the hospitals, outside of the physician organization, really to amplify that One Houston Methodist message and to make this as easy as we possibly can. So we'll come back to some of those points a little bit later. And very similarly, actually, in 2016 or 17, Michelle, when we really said, we've got to lean into digital innovation. And I will say, we focus on the fundamentals and the awards follow, but we have twice now with Newsweek and kind of a worldwide ranking of hospitals around digital innovation been number 10, number 11 in the world. So they're taking, the world's taking notice, and the outside world's taking notice because of the great things. And at that point, a lot of Michelle's time and energy was redirected into that effort, along with many of her colleagues, including Marc, who's on the chat right now. So with that, I'd love to hear about some of the digital innovation work that we're doing.
Great. Well, thank you very much. And I'm so excited to be here today, really, to just kind of walk through some of the things that we have been doing. Tisha has, really talked about access. And what I want to do is talk a little bit about some of the things that we're doing overall within the hospital. That's, overall what you can use, what some of our physicians are using as well. But, as Dr. Boom just talked about, our Center for Innovation really started back around 6-7 years ago. But it's really just a part of a larger innovation network. And what you see that's kind of on that spoke over there is that we have many of our colleagues across the organization that are part of it. And of course, Tisha is a part of that organization as well. But when we talk about that obsessive focus, we did come up with a name for ourselves, which was DIOP, which is the Digital Innovation Obsessed People, and it's kind of stuck with us. But it just really goes to show just how much that we are really obsessed with trying to improve overall our operations for our patients and our clinicians. Just real quick to show, this is kind of our approach to innovation. We do have a pipeline that we run through overall to look at, what is it working overall with the goals that we're trying to accomplish. We do a thorough family review, a pilot where we have this goal to either succeed or fail fast, and then we graduate to, when we graduate, we roll it out across our organization, or we have our category that we call kind of rest in peace. And we have had a few of those. But ultimately, look, we're here, and these are some of the things that really even Tisha talked about. We recognize that there are still frustrations overall happening within our organization. And the goal is that we want to try to use technology to the best that we can to help alleviate those frustrations that you all feel when coming in to try to get services from us. So, I'm going to talk a little bit about, again, the hospital innovations that we're working on. I know that many of you know we're working on building out a hospital in Cyprus. Several years ago, we did talk about, do we just want to focus in on the technology, or do we want to look at overall the grand themes of what we want to accomplish now that we're able to build out this new hospital? And so we made what we called future bets of where we believed technology would be at the time whenever that hospital opened up. And so you can see Tisha's been talking a little bit about, the self-scheduling, talking about the clinical and financial knowledge. I'm going to go through some of these that, like our smart room, what are the things that we're doing with voice over text. But the ultimate goal with any of these was not just to wait for these technologies to come up, but we are currently using most all of these within our hospitals today. One, it was to learn from it and gain knowledge and feedback to ensure that everything is working appropriately and that we're getting the benefits from the technologies that we're bringing forward. So one of them is our smart room of the future. And really it's about overall how can we improve the care, the comfort and connectivity as you as the patient and our clinicians that are taking care of you overall within the organization. And this slide right here really kind of goes into a little bit more detail about what we're talking about that. We call it our digital whiteboard and overall an engagement TV. The TVs in the room today, they really are more just for overall engagement and entertainment. Well, now with technology, we can bring to light more information to you overall as the patient in that room. Not only just to be able to see who is your care team, what are the things that you can do from overall looking into what goals do you have for that day, what is overall your pain score, but actually communicating even overall with your nurses and spiritual care and even your physicians. But we're also trying to give you also too with these smart rooms that we're talking about is giving back some of the opportunities for you to be able to change the lighting, to be able to change the temperature in the room. Some of those things that you're already used to being able to do in hotel rooms. But ultimately it is about your care, the quality of care that you are getting at Houston Methodist. And how is it that we are able to show you from your own TV screen now more, instead of having to wait to call a nurse to your room to be able to answer some of those questions. You can have that automatically overall within the TV screen that you're seeing. And I'm going to show you here in just a minute how we're using that now screen. It's just sort of multimodal, not only for these things, but to be able to do virtual care really in that room as well. So speaking of virtual care, and I know Tisha kind of touched on virtual urgent care and virtual visits that you can do with your physicians, but we've been utilizing virtual care overall within our hospitals for quite a few years now. We started off overall within our virtual ICU, and it was really a way for us to be able to use clinicians within our virtual operations center and an overall technology that we built that has algorithms built into it to help overall watch what's happening within our ICUs. And it was to look at within over, and you'll see some of the screen technology there, that when things start to occur, this is kind of predictive technology to help us overall predict where potential problems could overall happen so that our clinicians could intervene earlier. And so it's been extremely beneficial to us overall within our organization, but it was our first step into sort of to the virtual space. But since that time, we've been really looking at how we couldn't take this technology to the next step. And so we've been looking at how we could redesign overall the care that we're providing by utilizing virtual services. And so what you see here, and I talked a little bit about it with the overall TV technology, but you see the device too that allows us to be able to offer more virtual care overall within the patient room while you're here. But we also want to keep your privacy at as well to ensure that you feel comfortable with the camera in your room. One of the things that we're looking at for fall monitoring right now is trying to make sure that if we needed a telesitter or whatever into the room, that is a human being. But there's technology now, as you can see overall on the far right hand side over here, that allows the technology to watch and make sure that overall that you are doing well and that there isn't a potential fall risk. But it does keep your privacy first and foremost at hand. The other is just showing where now we can have clinicians who can beam into your room, not only to be able to see if they needed to do, if it's a physician that needs to do a virtual consult with you, but also too, all those other types of virtual services that we are looking at, how can we expand it? Not only just from the virtual consults, but maybe as a pharmacist that wants to come in to talk to you about your discharge medications that you will be going home with. But as you can see, going on to this next screen, we kind of even taken it a step further. And this gets into back what Dr. Boom was talking about, that obsessive focus that we have overall on our patients, how they're gaining access, but also on our clinicians to ensure how are we making sure that they have the best technology so that they can do what they do best, which is taking care of you. So with this virtual technology that we've had in place, we started our telenursing program. And what this was is you were being admitted or discharged into the institution. It usually was your bedside nurse that was coming to talk to you. And what we found was that the bedside nurse was getting interrupted multiple times just because of other things that she needed to. And we wanted to ensure that you were getting dedicated time with the nurse to be able to answer any of your questions that you had during your admit, or let's just say anything that you needed on your discharge instructions. Or you have now the opportunity, because we're using our virtual nurses in our virtual operations command center, to, if your family member couldn't be there at the time, we can actually connect them into this virtual call. so that everyone is hearing exactly what needs to happen during overall your discharge. What we found is that patients loved it. They were able to get dedicated time overall with the nurse for however long that you needed to. And the nurses liked it because they felt like they were being able to give you the service that you were looking for overall as well. But going a little bit further on using technology, one of the great things that we have found overall in technology is a device, a biomedical device, that is about the size of a $50 that can overall be placed on your body that is now capturing vital signs. And this technology, while it's really, really great, is capturing skin temperature, heart rate, your gait, and some other vital information. But what we heard clearly is not only that while you're here, some of our patients didn't like being woken up in the middle of the night while they're trying to rest in order for us to be able to keep taking your vital signs, which is extremely important for the quality of care that we need to be able to take care of you all. Well, with this device that we are now has been rolled out across all of our institutions, we can do just that. We can keep your vital signs and not have to disrupt so much of your nighttime to be able to get that information. And what you're seeing on that far right-hand screen is also what we have is an alert watch that goes along with the device that's being monitored 24/7 within our virtual operations command center, which again, looking at overall your how our patients are doing, and do we need to intervene because we see something that might be happening. So that data that's being collected is not only going into our EMR so that our nurses there on the unit can watch it, but it's also being watched by our virtual operations command center. This is an FDA approved device. We do see multiple other opportunities where we can use this type of technology. I will tell you, we're looking in potentially how it could be used overall within our EDs, and maybe at some point how we can send you home with this device so that we can keep monitoring you at home. The other is, and I will say AI. Let's talk a little bit about AI. I know everyone's heard about ChatGPT or Bard, and maybe you've even used some of those things. I will say, one of my friends the other day told me they used ChatGPT to develop a bedtime story for their child, which I thought was pretty unique. But, you know, how are we utilizing it internally here at Houston Methodist? Well, AI is really built on large data sets, so big data sets. So if you think about all the data that we have overall within our EMR, and then algorithms are built on top of that data set to be able to help predict answers or predict outcomes, whatever it may be. Well, we've been working with an organization that also has a large data set, Medicare data, over 22 years of Medicare data, and also few more years with Medicare Advantage data. And what they're doing is they're taking our data and comparing that data as well to be able to help overall give predictive and outcomes of overall with our patients here in-house and what measures that we can take going further. So it's been extremely beneficial, and what you're just seeing here is some screenshots that gives what we call data into the insights of overall and what actions can we take from those insights that we're seeing coming across. There are a few departments that we've been using it with, and you can see them on here, cardiology to CV surgery and orthopedics, that have really been able to use this data to help overall be able to take better care of our patients and the outcomes that are coming out of this data for them to be able to make better decisions overall. But the other thing is we're now working with another organization that helps us to determine what is outstanding that is potential a discharge, what we're calling a barrier to discharge. And it could be anything that from a lab test that needs to be done, or it could be you need to have another imaging, some type of imaging study or whatever. Well, we also know that when you've kind of gotten information from your physician that you are almost ready for discharge, that many of you're ready just to get home. And so sometimes it may feel like, wow, I'm having to stay here. Why am I having to stay here so long when our physicians have already said that I'm very close to being able to discharge? Well, we're utilizing this information that's coming back, and it's utilizing our data overall and AI to help our clinicians understand what are those barriers right now that are in place that is potentially holding up our patients being discharged. Our case managers are using this system right here very well to help notify areas when it is they can see that we've got pieces of data that are still, or procedures or things that are needed that are allowing our patients to have to stay here longer than necessary because they're ready to get home, and we understand this. So this has been a huge success, and we're still working overall with this organization to continue to overall develop and roll this out across our organization. So one of the other things that I have been very, very excited about, and I will say I probably about for the last couple of years have been talking, that I really think we have such an opportunity of using voice. We use it today. You use it in your cars, you use it on your phones, you use it at home. How many of you tell Amazon that you're ready to order something through your Echo device or whatever it is? Well, such great opportunities, and we're now working with an organization where it's utilizing voice over text. And this is where it was a challenge way back when that I will tell you Dr. Boom gave to us, and it was, how can we get our physicians back in front and do it in front of our patients, and really just having a conversation and not be tied so much overall to the computer to do the documentation of that conversation they're having with you. Well, we have a product today that we have been piloting that has been extremely successful for us. And what it does is it allows that physician to just truly have a natural conversation with you while you're in the clinic of overall of what's happening, what problem, what are the problems that you're experiencing, what are potential issues that you want very much the doctor while you're having that conversation with him. And all of that conversation then is being captured overall within our electronic medical record. And all the physician has to do at the end of that visit with you is go through the notes that are automatically generated within from that conversation and make any changes he or she feels as necessary or may not, and then accept the note. He can also be able to say what medications that he's prescribing for you and what's your next steps, which could be captured in there as well. What we found is that physicians are extremely happy with this. They feel like they now have the time to be back in front of you, and that our patients are very much appreciative for it as well, because you're feeling like you're getting dedicated time with the physician instead of actually seeing the side of their face where they're trying to type that information into the computer. So we're in a short pilot right now. Pilot has been successful. We are looking at rolling this out across our organization, but I'll tell you, we started with this with our physicians, but we're very eager to start working with either the same organization or possibly another one to do the same for our nurses. Our nurses have been overburdened with trying to do documentation in our electronic medical record as well. So wouldn't it be great as if when they're having a conversation with you at the bedside, that most of that is being captured overall within the electronic medical record. So a whole lot more to come, but I think there is so much opportunity here for us as health systems to be able to capture and utilize voice in a way that we've never experienced before. So remember, I talked about utilizing large language models. And one of the things that we're doing is not only do we obsessively focus over our patients, obsessively focus overall with how we can improve the quality of the way that our clinicians are providing services to you, but also how could we improve our service quality. What you're looking at here is taking data from overall phone conversations that you are having when you call into Houston Methodist. And what we are utilizing now is distilling that information down into a report that is easy enough generated for us to see where we have opportunities for improvement. What you're seeing right here is a patient's family member who their patient was, the spouse was here for a week. They called in 18 different times to try to get updates overall within this patient. And so what this tells us, data, is we have an opportunity here to improve overall the service quality that we are providing back to your family members. So how can we do better in getting information back that your family members feel like they are getting the information they need without having to call back 18 different times? Now, the reason this is so great is before we would potentially have a manual process of having to go through and read all of these things. Now we can use the AI that's built into this product to distill it down to just this area where there's potential outcomes that we need to overall improve. So we're getting to the information much faster, which helps us overall as an organization improve our service quality. And ultimately, again, what is our goal? It is to try to improve overall the service that you're getting here from Houston Methodist, and making sure that when you come in to get services from us, whether that's a virtual visit, whether that is inpatient or just outpatient services, that you're getting what you need in the way that you feel like it is that you want it and your experience is great with us. So thank you very much. I'm so happy that I was able to kind of share a little bit about what we're doing in the Center for Innovation.
Well, thank you, Michelle. You know, I often in these settings talk about how much I learn every time, but also, and usually I'm surrounded by some clinicians. I'm like, wow, we are so privileged to have some of the world's greatest clinicians here. We really are. We're privileged to have some of the world's greatest leaders here as well. So thank you both. You know, they're a little behind the scenes maybe from your perspective, but in the hospital industry, they're anything but behind the scenes, because these two are like on the whole speaker circuit and everything else out there, because others are coming here saying, wow, what is Houston Methodist doing around access, around technology, and all these things, around innovation. So thank you both. Proud of everything that you all are achieving. I talked a little bit about some of our philosophies there, a couple more philosophies around innovation. We have embedded this into operations. So it's led by Roberta Schwartz, who runs our main campus. You're a key leader in it, obviously, and you have a day job in IT as well. So, we really believe that when you search for innovations, we implement them rapidly. We don't pilot a million times. We pilot, it works, and it goes across the institution, or we're pretty, I think, strict in saying sometimes we just kill it, because, we'll try things. And that's part of innovation, obviously, is you try things, they work, they don't work. I can't tell you how excited I am by everything both of you have talked about. I hope you all are as well, because I think it's going to improve everything for you over time. And I watched all the linkages of this from, obviously the safety and the quality that these things provide. And like you said, access is quality, and everything you think about with that, but also how it changes the work for the people who work here. It connects them to the patients, which is really, again, back to that only things a human being can do, and let technology do many of the other things. And then at a big, big picture, and I've talked about this with many people on a lot of stages that I end up doing, if we look at the population curve of the US and where we're going, it's a little scary, because right now, if you look at the next 25 years, the working population, which we define as 18 to 64, goes up 4%. The over 65 population goes up, I think it's 42%. Within that, the over 85 population goes up 128%. And oh, by the way, that 0 to 18, they're shrinking by 8%. So we kind of have a population curve problem that right as, we've got Social Security needs to work, we've got Medicare that needs to work, you get less workers per retiree, like from 3.5 to 2.5. But what that means, if you think about people who require health care, 85 and up in particular, just as we need to care for them, you've got a bunch of social nets that are getting pretty stressed, but we've got staffing issues that are coming. So part of the goal of this is we have to redesign work as well. And so in doing all of this and leveraging technology, in linking our people to the only things that people can do and really things that connect with you, you're going to have a better experience in that situation. And so thanks again for everything you're doing. We got a couple questions came in. We had quite a few questions before. Quite a few of those kind of got covered, like several of Tisha's got covered. But we hear you. Kind of some of those quotes that we heard from Tisha were some of the embedded questions we were getting here. As why does it take me 3 months to get into a doctor's office, right? We got a few of those. But I want to pull a little bit of those. Okay, so I'm going to paraphrase a question here, but the way I read it was, hey, I'm kind of used to that old days of a small little doctor's office, and there was a doctor and 4 staff, and everybody knew me, they knew my name, and when I called, I talked to the same person every single time, and they knew my story. How do we do all that we're talking about here? As of course we are so large, and really that situation barely exists anywhere right now. yet have people who know me, who know about me, who can guide me and have the knowledge about me to guide me in those situations. There seems like there's a tension there. So how do we handle some of that?
Absolutely. Very good question. And I think there's a way that we can do both. And we have to be able to make this a win-win. So when you talk about I'd say the historic days, back in the day, to your point, you think about a small physician office, and I would call and I always talk to Sally, and Sally knew everything about me or what have you. What we're seeing more and more today is with a lot of those models, unfortunately, Sally is not available to pick up the phone every time you call anymore. And so what's happened is Sally is dealing with patients that are in front checking in or helping the doctor do other work. And so what's happening is when patients are calling into those familiar clinics to get scheduled or to get service, the staff, they're dealing with the patients that are there on site. And so what happens is you're not able to talk to anyone. You end up with voicemails, you end up with phones ringers or what have you. And that provides a frustrating experience as well. So our goal is to make sure that patients are able to get their needs met. And no, it may not be with the same person every time, but we have dedicated staff also that are dedicated to similar areas as well. And so we're trying to meet in the middle, and then through our technology and innovation efforts, we have tools in place where we can make sure that we understand our patients' needs, we know who they are, we know what they've been seen for, and we can kind of follow that journey through our EMR and through the technology that we have in place, so that when patients call, they feel like they're talking to a familiar voice. At the same time, they're still getting the services that they need immediately.
So, sometimes it's pretty straightforward, right? Hey, I got the sniffles, I need to see somebody, I need a primary care appointment. Sometimes it's really complicated, right? Trying to figure out where somebody needs to go, what services they need. How do we use both training, assignment to the right people, technology? How do we use that to help guide people into the right place?
Excellent question. It is one of the transformation initiatives we are working on right now. So behind the scenes within our EMR, we're actually building algorithm decision trees. And they're questions that are actually developed by our physicians. These are, clinician-led algorithms that we're building into the EMR. And based on a patient's symptoms, it guides us to what question to ask. And then based on how they answer the question, it directs us on how to schedule. So it will tell us who they can schedule with, who sees those indications, how much time they need. So we're in the process of building that out right now.
So I noted one of your stats, and I want to ask a complicated question around it, and then picks up on some of the threads that were coming in here. You said 80% of people would prefer to schedule online. So I guess first off, what percentage are we at? What are the big obstacles? Because there's a gulf there. But I think about, okay, if I'm going to, I sure as heck prefer to schedule online for all the flights I take, right? Which is plenty. But I pretty much know I'm going from here to here, and I don't have to worry about which aircraft are they selecting, or did I get the right pilot, or, et cetera. When you're scheduling and self-scheduling, you do get into the situation, and one of the frustrating areas you talked about, or frustration areas that you talked about, where, hey, I'm the patient. I may not know which person really is the specialist for this that I need to see, right? I don't even understand which one that might be, right? So how do we kind of bridge that gap? I mean, some of that was, I know, working with these departments. So multi-phased question there, but all tied together.
Let me see if I can capture it all.
Okay,
and
good.
If I miss,
good. If not, I'll get you.
You'll get me. So a couple of points. I know you mentioned the stat, and this was a study that we looked at, that it did show that the majority of patients prefer to schedule online. Whether they do it or not is a different story, right?
Sure.
And there's many reasons why you don't. We live in Houston. If I'm in traffic, there's some times where I'm just going to call because that's what I'm able to do at the moment while I'm stuck in traffic. So it's an interesting dynamic. I'll use primary care as an example because I think primary care has been the furthest along in terms of online scheduling and self-service options. So up until recently, we had our appointments online, we could schedule online, but I continued to say, but guys, my call volumes are still going up. and we're growing, we're still adding physicians. And I'm like, I have availability online, but our call volumes are not decreasing. So there's nothing, I still have to have coverage for the phones. So a couple of changes have recently been made. One, with our website, as I mentioned, we're showing the availability. So although we had scheduling online, it wasn't always easy, right? You could do it, but now we've just made it much more convenient and working in partnership with our IT colleagues and our marketing team. And so that's one change where we have seen a significant increase with our online scheduling. And I will say last year was the first time that I can actually say our call volumes decreased. So our online scheduling increased, and I actually saw a correlating decrease in our call volumes. That was great to see. So in terms of what percent of patients are scheduling online, for primary care, we're at about a third. I'd say 34 to 35% of all appointments that are scheduled online. For our same day clinics that I talked about, we're over 50%. For our specialty, we're not that high.
Because it gets, as I said, it
gets complex. And so that's where we're in discussions right now, but what's the best approach for this? So from a specialty standpoint, to your point, a patient may not always know where they need to schedule, what specialists they need to see. And so we do have some availability online for some specialists that are more straightforward, or some, although they're in a specialty, they still are more of a generalist within that specialty. So those are more easy. For the more complex, we're actually looking at those same decision trees and seeing how can we easily embed some of those questions online and on our website, that again, a patient can answer those questions and it will direct them to schedule self-service online, but it's directing them to the right specialist.
Because you can bet that's really frustrating for the patient who gets there and says, and the doctor says to them, well, I'm sorry, Mrs. Jones, you are, this is not what I do,
absolutely,
right? Even if they're in the field, and let me refer you to my partner, but oh, by the way, now we got to schedule you 3 weeks later. And it's frustrating for the doctor too, right? So, so I put that out there just because we have to do a lot of work to really make this smooth and facilitated and do it right.
Absolutely.
So
one other quick point I will make related to that, though, its current state right now with our specialists, we do have the indications that they see online. It's not dynamic, as I mentioned, with the algorithms and the questions, but today for our specialists that do have online scheduling, patients can see the diagnosis, what body part, the indication, and that's all built into their profiles to help guide them currently.
Great, thank you. Well, Michelle, I want to ask you a couple of questions. I get really excited about both of these areas, obviously. Some of AI and some things, though, you see a lot of stuff out there, it kind of starts sounding a little scary. Talk a little bit about why Houston Methodist is the right organization to lead this in healthcare and for the people we serve because of who we are and the approaches we take.
Yeah, it's a great question, and I mean, it could be. I tell people all the time, remember, what is AI built on? It is built on large data sets with, large language models and algorithms. So if you got bad data in, you're going to get bad data out. And, we as an organization have really taken the hard stance of ensuring, that the quality of the data that we're using, which is our own data, and our data scientists that we work with or that are part of Houston Methodist, if we're using any kind of AI, right now we're using the AI that's embedded overall with our vendor partners that we have, but we validate all of those algorithms that are being used because it's extremely important to us if we're going to rely upon the information that's coming out of the AI, and especially if it's giving us what are the potential next steps that you need to take with this patient, that we believe it's appropriate and that our team can rely upon that information coming across correctly. So again, getting back to kind of core quality is extremely important to us, and so we validate everything that is coming across in those algorithms that we're utilizing. But yet the other piece is cybersecurity is very important these days, and we know how it's being very much misused across the world. So we take that at the highest priority level as well in this organization to ensure that data that's being used in any of these AI tools, that we're also protecting that data, because it is our patient's data that is in there. So, it's multifold when you look at how it is that we at Houston Methodist are not only using it, but actually protecting the data as well for our patients, so that we are using it in a quality way, but also having it being protected so that they have nothing that they need to worry about from us.
Well, thank you. And with our faith basis, with our values basis, with our focus, patient at the center of everything, and really, you think about unparalleled safety, quality, service, innovation. There's a reason safety, quality, why it's in that order.
Reinforces it, yes.
Culturally, this is the kind of organization to say, hey, there are tough questions here, but we can put our head in the sand, not use this technology, and it's just going to develop without us, or we can be leading in doing this and making sure it's used right and done right. And that's really what we are dedicated to. So we have incredible teams doing that. I did get a couple other questions, and I want to make sure I cover them. One asked about, if I get on one phone call, can I schedule multiple interactions? Whether it's 3 different doctor's visits, or I need a doctor and an MRI and physical therapy appointment. Can I do that? How will that work?
So that is the goal. We're not 100% there yet, but if you call our front door, our main line right now, and you're looking for a new doctor and you need to schedule multiple appointments, that team actually does have access today to schedule across most of our specialties.
Okay, great, perfect. That's a good, short, succinct answer to that very direct question. I'm going to be wrapping us up here in a minute or two. I want to talk a little bit about, we talked a little bit about the AI and people's feelings. Talk a little bit about how this has been embraced by our staff. Tell the story of virtual nurse. So, I will say, it was a little counterintuitive on the front end to say, okay, so we're going to put virtual care in-house. The ICU, yes, right? Think of the ICU, this is like a command center, right? It's almost like air traffic control, where you're able to look at data for all these patients because they've got lines in and everything else. And so you can put AI around that, you can put expertise around that. I mean, it is like literally air traffic control to be looking for issues. But when you start thinking about discharge, admission, and things like that, it almost seems counterintuitive. But it's been anything but that. But how did the nurses react when we kind of rolled this out, and how did that get implemented and then embraced?
Change management is probably one of the hardest things that any organization will have to go through. And change is not easy, and that's what we're trying to do, is change the way that we care for our patients and allowing our clinicians. And I will say, when we very first rolled out virtual nursing, I will say our nurses were very skeptical. It is, what do you mean? This is what I do, so how can we do virtual nursing? But it didn't take but more than a week. I will tell you that once we started it, and Roberta Schwartz was, trust me, let's try it, trust me. But very quickly, they were able to see the benefits of overall of us doing virtual nursing. One, it got them to be able to do, and this is what we say, let's use technology to get our clinicians doing what they do best, which is taking care of our patients at the bedside, or doing, not having to do some of these other manual tests that you can do with technology. But not only did we find that our nurses, they liked it, they were really enjoyed having the opportunity now of not having to go through and be interrupted, but our patients really enjoyed it as well. One is they felt like they were getting the dedicated time they need to have all of their questions answered, during the admission and discharge, but also, two, they could connect their family members in, because their family members aren't always able to come and be with them when they're being able to discharge. And there's so much information that you go through, it's kind of hard to remember.
So suddenly the daughter sitting in California can sit there and basically be on that same interaction with when you're having to get all that handoff, all the instructions to go home. So it was really good.
Well, exactly.
It was a fascinating change management thing to watch, and there was a little, dig in, and I mean, not a week or two, and units were both saying, well, never take this away from me.
Yes.
And then everybody else around the institution was like, when do I get this? When do I get this?
Yes.
Because it's been a phenomenal advance, and we see lots of this. So very excited about how all this technology improves care for everybody and care for the people here. So I want to thank both of you for being here today. As you see, two really amazing leaders, and hopefully you've gotten some questions answered online as well. Thank you to Adam Myers. Thank you to Murat Rokan, both for being there, also two excellent leaders of ours. Thank you all for being here. We will have a wonderful session in April as our next time together, and I look forward to seeing you then. And in the meantime, have a wonderful, wonderful late winter and spring pretty soon here in Houston, Texas. Thanks so much.